Hi, I'm Dr. Tish with our Med-Minute question of the week. So the question is, how does fractional CO2 laser differ from fully ablative CO2 resurfacing? Well, essentially they're the same thing. It's both a CO2 laser. It just has to do with the extent of its treatment. So to backtrack a little bit, for people who don't really know what the CO2 laser is, it's a carbon dioxide laser, and when we use it in aesthetics, we use it to help improve the skin's integrity. So the fully ablative one is really, we turn the laser on a high intensity and it basically removes multiple layers of skin off. It vaporizes them, actually cooks them off. What is the reason why we'd want to do that? Well, when we want to do a major resurfacing, we want to get rid of some lines, we want to get vertical lip lines rid of that. Acne scarring is a big one, and things like that. And so basically, and colored pigment changes, it really will take off multiple layers of skin. And the problem with ablative laser is there's a little bit of downtime, because since it's taking off so many layers, it's almost like you have a mild burn. So you're going to have some redness afterwards, and you have to avoid the sun, and you might be out of commission really as far as being able to go in public for about a week or two. But you're going to get the maximum benefit. You're going to get a lot of skin retightening, you're going to get a lot of wrinkle reduction, you're going to get rid of acne scars and things like that. It's a very powerful treatment. People probably need to be sedated when they get that, because it can be a little uncomfortable. Then when we switch over to the fractional CO2 laser, it's kind of like the word says, fractional. It's actually doing a fraction of that therapy. So instead of treating all of the skin, it actually makes little micro punctures in the dermis, so that if you look at a square, maybe only a third of it hasn't been treated. So it makes these little micro punctures, like drilling little holes in the skin. And what happens is, the purpose of that is it creates an inflammatory response where that normal tissue will now fill in that tissue that's been treated. And so it stimulates collagen production, it actually helps with scar reduction, it helps with acne scarring and fine lines and pigment as well. But it's a much milder treatment. And so what that means is there's much less downtime. It's less uncomfortable, and so people just experience a little bit of redness afterwards for several days, and then they start noticing the benefits of it. The downside is what I said, is it requires multiple treatments to accomplish the same thing as a fully ablative one. Now, there are some perks to doing that fractional therapy. Is we can add other components to it. We can add PRP, which is platelet-rich plasma, onto the skin after it's been treated. That will kind of percolate into those holes with additional factors to help healing, to help the skin integrity, to help tightening, help with collagen production, or we can even use exosomes, which are of course a type of stem cells, added onto that. That's typically not done with fully ablative, because there's no little punctures there for that to go into, and really all of that surface has been removed, so we've let that go on its own. So I hope that kind of explained those two treatments. They're really used for aesthetic purposes. One is much more of a mild treatment, and one's more of an aggressive treatment. So that's our question for the week. Remember to submit another question down below.